The World Health Organization is urging countries to move fast and distribute malaria prevention at this stage of the COVID-19 outbreak in sub-Saharan Africa and to do their utmost to safely maintain these essential malaria control services. Speaking at State House, Nairobi during this year's End Malaria Annual Council meeting convened virtually by the Bill and Melinda Gates Foundation, President Uhuru Kenyatta, who is the current chairperson of the African Leaders Malaria Alliance ALMA, reiterated that resource constraint brought about by COVID-19 risked rolling back the progress made in the fight against malaria.
To existing problems because of new issues that are coming up. COVID-19 has had a huge impact in terms of where we've needed to focus government resources, and in some cases at the expense of ongoing programs that have been having success.
The fight against malaria on the African continent has been witnessing less interest from developed nations and multilateral partners as the countries and agencies redirect scarce resources to the more pressing coronavirus pandemic. According to Bill Gates, the ongoing global push for a COVID-19 vaccine has presented an opportunity for accelerating the search for HIV, AIDS and TB vaccines. The president, who was accompanied to the meeting by Health CS Mutahi Kagwe, urged African governments to apply information sharing and pooling of resources as seen during the continental COVID-19 response to the fight against malaria.
We are facing increased constraint, especially with regard to resources that we can deploy to existing problems because of new issues that are coming up.
Nigerian billionaire businessman Aliko Dangote, who also spoke during the meeting, reiterated President Kenyatta's call for greater participation of the private sector in the fight against malaria in Africa.
Most states at the lower level, they are the ones in charge of the community health workers. And but going forward in terms of financing, I think we need to really get the private sector very, very much involved.
WHO and partners have further developed guidance to ensure that those suffering from malaria can safely receive the care they need within the package of essential health services to be delivered in the COVID-19 settings. Dana Rose, K24.